Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Molly Mraz, Public Information Officer for the Harford County Health Department, and your host for today's Public Health Matters, the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. Today, we are going to talk about emergency preparedness and the importance of being ready in case something unexpected occurs. There are many reasons to prepare for an emergency, but most Americans are not prepared for possible emergency situations that their family members may face. We are lucky enough to live in Maryland, which has been recognized as one of the 17 states most prepared for public health emergencies. However, there are a lot of things that individuals can do to ensure safety during an emergency. Joining me today to talk about this topic are Rick Ayers, Deputy Director and Emergency Manager for the Harford County Department of Emergency Services, and Lisa Swank, the Emergency Preparedness Coordinator for the Harford County Health Department. Welcome to our show, and thank you for being here today.
Thank you.
Sure. So, Rick, this is everybody can finally see who you are instead of just hearing your voice on the phone. This is Rick Ayers, everybody.
Happy to be here.
Rick and Lisa, just really quickly, if you want to talk about what you guys do at your job, and Lisa, what you do at the health department, and Rick, what you do for the county. Start with you, Lisa.
Okay. So I'm the Emergency Preparedness Coordinator for the Harford County Health Department, and basically our job at the health department in a disaster is to look at all facets of public health following a disaster during our response. So that might include a variety of things. One of those things might include environmental health safety, or it might include nurses that have to give medications or vaccinations. It also might include our behavioral health unit providing mental health assistance, or providing assistance during a radiological event, such as monitoring and decon. Some of the other things that we might be concerned about also are vulnerable populations and resources that they might need available to them. And then, of course, our healthcare partners within the community. If we are, following a disaster, have to work on a recovery effort, we want to make sure that the healthcare infrastructure is back up and able to assist our residents.
And luckily you can partner with Rick. Do you want to talk about what you do?
Sure. So I'm the Deputy Director of the Department of Emergency Services, which is the second in command of all the branches that make up our department. But then one of those branches happens to be emergency preparedness, and I'm also the governor-appointed emergency manager. Each one of the counties in the state has an appointed an emergency manager from the governor. And one of the things that I try to remind people is emergency preparedness is not just when the emergency happens. I mean, we work 24/7, 365 to plan and try to make sure our citizens are prepared long before any emergency or disaster gets here. We try to learn from the previous emergencies that we've had, and if there's things we can mitigate against, if people lose their home from flooding and they're on the water and we can get them to not build there again or build on higher ground. I mean, anything we can do to mitigate before the next storm. And then finally, we have to be prepared to respond during the disaster. And then the last part of being prepared is how we recover from the storm, because a lot of our people, you know, are pretty tolerant on us responding, but they want us to get the county back to normal as quickly as possible, and the recovery sometimes does take a long time.
Right. And your partnership is so important because your jobs rely on so much of each other, and oftentimes, I mean, you're related to, we do a lot of group exercises together with the county and the health department. So that's a great partnership that's been formed, you know, especially with you two being in your roles.
We've worked with, during several emergencies together, and we've known each other for a while now. And it's so nice to be in Harford County where everybody does have a nice relationship with each other. It just seems like it's that kind of county where first responders come together, and that does not always happen in every community. And so we feel very fortunate that we have that relationship.
Right. What do you want to talk about? What kinds of disasters would somebody prepare for?
We have a lot of natural disasters in our community, and Rick, do you want to kind of highlight some of those that we've experienced?
Well, I mean, pretty much on the natural disaster side, we've dealt with almost everything. We've had the hurricanes and the tropical storms. We used to laugh that we would put on our slide earthquake until we had the earthquake impact our region a few years ago. We've had several major flooding events. So, I mean, we've activated our EOC through the last several years for a lot of natural disasters, and I feel like we're pretty fortunate that Harford County's did pretty well during all of those.
What types of challenges would somebody have to face or prepare for during an emergency?
Say that again? I'm sorry.
Like what types of challenges might you have to face to prepare or respond to an emergency?
Well, I think one of the challenges that we're faced with is just trying to get the citizens in the county to listen to what our message is that we're trying to get out, and you know, try to follow our directions. Like, I mean, certainly you've heard the term "turn around, don't drown," but people still drive through the high waters. When people across the country have been ordered to evacuate because of certain disasters, I mean, some people listen to that warning and some people don't, and then our public safety people are left with having to try to rescue those people in the middle of the storm. So at least telling our public to be prepared, have a plan, and then when I'm putting messages out to our citizens, just try to listen to our message, and we're really looking at the safety of all of our people.
And part of that safety really is also making sure that you take care of your health for both you and your family. That might include vaccinations as well. We always kind of think about pandemic, and one of the ways that we can prepare for a pandemic is to make sure that individuals are making sure they get their flu vaccination, but also making sure that they have an emergency preparedness kit. And that kit can include a lot of different things. We're looking at non-perishable food. We're looking at making sure that they have their medications. If they have durable medical equipment or oxygen, that they are prepared for any power outages that might occur. And I know Rick usually puts out messages about generators, making sure that that generator is outside the home, and that we're keeping those safety messages out in front for each disaster.
Having a family plan.
Well, another thing we started a few years ago is we started a program called Prepare Because You Care, and we try to run around 4 or 5 of those a year, and we strategically locate them around the county so people don't have to drive a long distance to go to take one of those. Our next one of those classes is on May 9th, and it's going to actually be at our Emergency Operations Center in Hickory. And it's 1 night a week for about 3 hours, last 4 weeks, and then you'll get a certificate. You'll be certified in CPR and stop the bleed, and it really just teaches our citizens how to be a little bit prepared for a disaster. And because in the middle of a true disaster, we're going to be limited to being able to reach everybody quickly at the same time. So any training that people can have to kind of be self-sufficient themselves is one of the goals of emergency management. So
you talk about CPR and that being such an important, like I would have never thought to be, what the importance of CPR and being trained in first aid would be for a natural disaster. Do you want to talk about why it's so important?
If I can, Rick. So really we want to encourage all family members to take a CPR course or first aid class. Emergencies can happen at any time. And you really are your first responder for your family. Those few minutes, as Rick's pointed out before, those first few minutes when there is an emergency or an accident, you could be the one to save your family member's life by just knowing a few skills that you could learn, and you just never know when you'll be somebody's hero.
Right. And talk a little bit more about kits, emergency preparedness kits, what to include, pets, pet preparedness?
Sure. So emergency kits can include a lot of different things, and we try to encourage individuals, as Rick's always said, we try to prepare for 7 days because we never know when we're going to be able to provide that assistance. So the more that you are prepared for you and your family, the better off you'll be. And that might include canned food, goods that you rotate. You don't want to keep them on the shelf too long. You want to make sure that you have 1 gallon of water per person per day, and you will go ahead and rotate that as well. That you have a can opener so that you can open those non-perishable foods. Making sure that you have things for your pet. Pets are really important to us, and we want to make sure that you have pet food on hand for those beloved ones that we consider part of the family, and also to make sure that you have medicine on hand, that you have over-the-counter medications that can help with fever or with swelling, that you have an instant ice pack that you can activate, bandages, tweezers, scissors, all of those things really are necessary. And again, we never know when we might need them.
Right. I wonder how many people you just scared talking about this stuff. Like, I'm sitting here like a deer in the headlights.
I'm a nurse, so I try to think of all those things that you might have if you have a medical emergency. So maybe I am a little more over-prepared than most, but I do try to impart that message to everybody.
And I try to tell people, some people look at it as maybe a waste of money, and I say, well, it's not really a waste of money as long as you keep rotating. So use your water, use your canned goods. So you have to make the initial investment to go and buy the stuff that you should have at your home, but before it expires, use it and just replenish it, and it's not really a waste of money at that point. You always have that supply at your house. So that's what I try to tell people, because some people will say, well, it's just going to cost a lot of money to have something sitting in our basement. Well, not if you use it.
Right. Yeah. I'll just walk to your house.
Yeah.
And one of the tricks in terms of water is that, I've always heard that you can also, you can put water in the bathtub if you're in a pinch. And you always have a hot water heater that has water in it. So there are some little tricks that if you know where those resources are, and I think that's something we like to do in the county and is important for every emergency, is knowing our resources. Where can you go to find things, making those relationships. So, although you're going to have your family prepared, you also want to make sure that you are friendly with your neighbors, that, your neighbors know who you are, you know your neighbors. If somebody needs help or if you need help, you have somebody to go to that can assist you. So we always try to have everybody create their own first response network.
Yeah, especially if I would order any kind of an evacuation and you have neighbors that maybe can't drive. I mean, instead of relying on the county to try to come and get those people, if you can help your neighbors doing those kind of things to help them evacuate or to get out of that area. We always ask our citizens to try to help each other.
Right. Do you find that is usually the case?
I'm very impressed in Harford County. I think our citizens are really tremendous. I feel very fortunate with the relationship I've been able to develop with the citizens in our county, because I think most of them do take emergency preparedness pretty serious.
Right. Except me, who doesn't have a kid.
Well.
But I'll just come over to your house.
Okay.
Can we just back up? You were talking about water and expiration. Does water, what's the shelf life?
There is actually a date, that is printed on the jug, on the water jug, or the gallon, whatever type of water that you purchase. Usually there is an expiration date. So you just want to make sure that you're paying attention to that. Our food safety individuals at the health department would be grateful as well. We're always considering different kinds of safety, and that's one of them in terms of food safety. So, in terms of cooking and that kind of thing, you always want to make sure that if you have perishable items in the home too, and we're looking at maybe after a disaster, and you have things in your refrigerator, you just want to make sure that you're not consuming items that could cause illness. So we always remind people that if they lose power, you want to make sure you're throwing those perishable items out and not trying to save money by eating them. We certainly don't want you to get ill by eating things that really should be thrown away in the trash.
Right. What if you were stranded in your car and then, just name a few things that would be beneficial to have in an emergency kit for your car?
So for a car emergency kit, we always want to say something about jumper cables, because you never know.
And I always think of the, when you might get stranded in your car, and a lot of times it would be a winter storm or something like that, so making sure you have a blanket and, to be able to keep warm. And
flashlight.
If you're going out in those kind of conditions, then maybe you would want water and canned goods in your car if you get stranded, because some parts of our country, people have been stranded in their cars for days.
Right.
Not so much in Harford County,
yeah.
but even during the back-to-back blizzards we had a few years ago, we did have people stranded in their cars in the northern part of the county for several hours, not several days.
Right.
But it would have been nice for them to have some of those things in their vehicles.
Right.
And flares are always nice, in terms of making sure that other drivers can see you if you are having trouble. Sometimes that's one of the key things if you're having trouble in a vehicle, is making sure that other people are seeing you and avoiding any further injury that might result by them just not noticing you along the side of the road.
And always have a phone charger, because if you have your cell phone with you and you have the ability to keep it charged, at least you can hopefully stay in contact with the 911 center or somebody.
Right. What, Rick, if residents had to evacuate, what are some crucial items that they would need to take with them?
I think, it depends on how quickly they need to evacuate and what the emergency is, but if it's quick and they got to get out of there, try to remember at least to take your critical papers with you that you have, change of clothes. I always tell people to take cash if they have cash, because if we're dealing with power outages, they might not be able to get money out of an ATM machine or anything like that. And everybody in your family, as Lisa talked about, having a plan. Like if your family, if there's an evacuation, the chances of all your family being together when that evacuation order goes out is probably slim. And in a lot of those cases, the cell towers might be jammed with everybody trying to make phone calls, and you might not even be able to talk to your family members. So kind of like talk through that, at dinner one night with your family. If we were going to evacuate, is there a relative that we could all agree we're going to go to out of state? That way, if you can't talk to each other, at least you kind of know where you might want to go.
Right.
So having those important phone numbers handy.
Yeah.
And any insurance cards that, you might need, be it homeowner insurance or medical insurance. You just want to make sure, and also that you have a list of the medications. That is important. Social Security card, if you have a passport, anything in terms of that kind of document. You really want to keep them handy and together, maybe in a place that's easy to grab and that you don't have to go searching through the house for.
How much time would you give somebody to evacuate? Like, I'm just thinking in my head, how am I going to, I know that I have to evacuate, but how soon do I have to evacuate to be able to grab everything I need to grab?
Well, in a lot of cases, like if it's a weather event, the Weather Service does a really good job giving us advance notice of the storm. So if it's a hurricane type situation, you're probably going to get told to evacuate even maybe the day before. So in those kind of cases, you'll have a little bit of time to get your stuff together to get out of there. But let me give you a different example. Say we have a release at the nuclear power plant at Peach Bottom, and I tell you to evacuate. Well, you're not going to want to take a lot of time in that kind of situation. You're going to want to evacuate right away and get out of the 10-mile area of the plant. So it's all dependent on what the evacuation is from, and sometimes you might have more time and other times you might not.
Right, which brings us, we can talk about radiological disaster if you want to talk about Peach Bottom.
Sure, it's one of the things that I try to educate, especially the people in the northern part of our county that live in that 10-mile area. If you don't know, Peach Bottom is 2 miles across the state line into York County, right along the Susquehanna River, but the emergency planning zone that we train for is a 10-mile, 360 radius around the plant. So that comes into Harford County about 8 miles. And there's about 12,500 people, Harford County people, that live in that part of the 10-mile area. So we train yearly on how we would deal with an incident at Peach Bottom. In fact, every 2 years we get evaluated by the federal government on how we would do during an incident at Peach Bottom, and we have to do a full EOC activation and go through a scenario that we don't know what the scenario is. But if there would be an incident at Peach Bottom, the first thing that would happen is the plant would call Harford County on a direct ring down line. They would tell us what the incident is. At that point, we would make the decision probably to activate the EOC, and then they would give us whatever protective action decisions they thought maybe would be warranted for the public, and that could be things like shelter in place, evacuation, taking KI. I'll let Lisa talk a little bit more about the KI in a minute, but you know, after they give us their recommendation, then our senior state official is the Secretary of the Maryland Department of Environment, and they'll get on the phone with all the counties and say, look, this is what the plant thinks we should do. You agree, not agree? Because if you start evacuating people out of an area, you have to make sure that that's really warranted and what you want to do.
Right.
And all those decisions would be made fairly quickly with the 5 counties that would be involved in the 2 states, because we have Maryland, Pennsylvania, and then 5 counties that would all have to agree. And so that's some of the things that we would be doing right away if there was a major incident there.
And then you want to talk about KI?
Sure. So potassium iodide is actually something that everybody has access to. If you live in the 10-mile radius, you would simply contact the health department, and you would be able to pick up that potassium iodide for free, no charge. And basically what that does for you is it protects the person's thyroid. And why are we worried about the thyroid? Well, the thyroid produces a lot of hormones that are really important, especially to kids, in terms of growth. So it produces a growth hormone, but also metabolic activities in terms of giving our body energy. So if you have any familiarity with the thyroid, some individuals no longer have a thyroid that works correctly, and you're on medication. One of the medications is Synthroid, so we take that every day. And to try to prevent that from happening, to try to prevent the thyroid from losing its ability to perform for our body, we actually want individuals to take that potassium iodide. It's a, quote, safe iodine that it's absorbed by the thyroid, so that the thyroid then no longer absorbs the radioactive iodine that might be in the environment. So it basically protects the thyroid so that you can continue to function. That's one thing that the health department is responsible for in terms of residents' health during this type of an emergency. And the other thing is actually, as Rick mentioned, one of the things that we might ask you to do is to evacuate. And part of that evacuation process is to actually perform monitoring and decon, where we're actually detecting, finding out if you actually have radiation on your body. And if you do, we would provide that decontamination, which is simply just going into a shower using soap and water to remove that radiological dust that might have settled from the atmosphere onto your clothes or your skin, and then making sure that that's removed correctly. And then you would be able to go on your way if we were able to remove all of that. And if not, we have medical services that would be able to assist you in terms of, you know, removal that we could not take care of in the field. So.
Okay. How are people contacted if there was some sort of emergency?
Good question.
Radiological emergency.
So Peach Bottom, well, all power plants in our country have sirens that are in that 10-mile area that is supposed to be what warns the public of an incident at Peach Bottom. I don't have a lot of faith that, in other words, that people, if they hear the siren, would even know what to do. And in some cases, if they're inside their homes, how well they're even going to hear the sirens sometimes. So if they hear the sirens and they live in the 10-mile area, that should trigger them that something's wrong, and they should be tuning into our radio station that we use in Harford County, which is our primary warning radio station, which is WXCY 105.7. And then any time that we would be sounding the sirens, in conjunction with that, we would be sending a preparedness message to the radio station. So if they tune into the radio station, they'll get told, look, there's an incident at Peach Bottom, you should evacuate, shelter in place, or whatever. But because I don't know that everybody would know to do that, we would be using our emergency notification system as well, and I would be sending a phone message out to the people in that 10-mile area. And that's why it's critical that the people that live in Harford County, if people have a home phone number, they automatically get that call because they have a home phone number registered in the phone book. But the chances of people being by their home phone is probably not real good. So we really need to encourage people to register their cell phones in that system. And they can do that by calling 410-638-4029. And if they call that number, somebody will take care of registering them in the system, and they can put as many cell phones for their family as they want, and then they'll know they're covered.
And then they can also call that number to register for the Prepare Because You Can.
Yes, and like I said before, our next class starts soon on May 9th, so they can register for that as well.
Okay, good. So we have about 2 minutes left. If you want to finish up and just share any other information that you think is important for our viewers.
Well, we just talked about it, but certainly a couple things that I just wanted to remind everybody is the importance of having that number in the emergency notification system. Anytime we have a major disaster in the county, that's not just an incident in Peach Bottom, that's kind of the way I'm going to get a message out to our citizens. I use that system, and pretty much anybody else in public safety in Harford County has access to my system too. So the message might not be from me, it might be from somebody at the sheriff's office, but all the public safety agencies in the county have access to use that system. So it's very important that we get your cell phones in there. And I really do encourage, the whole topic was preparing and having a plan, so if you can take one of our PBYC classes, that would be great. And then the last plug is making sure you have the right insurance. A lot of people think they're going to be protected during a disaster with just their standard homeowner's insurance policy, and then they find out really quick that maybe that's not the case, and they need flood insurance if they don't have it, or renter's insurance. So make sure you talk to your insurance agent and make sure you have what you should have. I mean, insurance agents should be able to help you with that.
Yeah, because you can't get that last minute if there's a disaster.
Right.
You can't call up and say,
no,
can
you have
just
to have it
retrofit
enforced
my
for 30
insurance?
days before it's, yeah, that's
Right.
true.
Okay.
And if I can, just one quick message is that an emergency can happen at any time. It doesn't have to be a disaster. It can be an emergency that happens tomorrow, or or an hour from now. And so being ready and being prepared is really important for everybody.
Yep.
Great final messages. Thank you both so much. That is all we have time for today. I would like to thank my guests on today's show, Rick Ayers and Lisa Swank. If you would like more information on emergency preparedness, please refer to the resource page after this program, and join us next time for another important health issue that matters the most to the citizens of Harford County. Thanks for watching.
You've been watching Public Health Matters, brought to you as a public service by Harford Cable Network, your county connection.